Having a kidney biopsy always worries people. The truth of it is that kidney biopsies are a minimally invasive day case procedure that provide us with a huge amount of information and enable us to tailor the treatment of the kidney problem to you. So I'm going to try to allay your fears about having a kidney biopsy in this short video. The vast majority of kidney biopsies are performed as day case procedures, with 99% of people going home the same day. There's a minor risk of bleeding, and the risk of bleeding is dealt with by making sure that the blood pressure is normal before the biopsy is performed, making sure that the blood clotting is normal with a blood test, and making sure that any medications that are likely to affect the blood clotting, such as warfarin, aspirin and clopidogrel, are stopped the requisite amount of time before the biopsy. On the day, the patient is taken down to the treatment room. You lie face down on the bed, and the skin of the back is cleaned, and the kidney, usually the left kidney, is examined with an ultrasound. And that's to make sure that the person doing the biopsy feels that it's safe to proceed. And what I do then, clean up the skin, put a tiny bit of local anaesthetic which stings just for a few seconds and then wears off into the skin, and then put local anaesthetic all the way down to the capsule of the kidney, because I think that that makes it more comfortable after the procedure. And again, using live ultrasound guidance, I put a tiny needle down to the kidney and take a very tiny core of the kidney away that's about 1 centimetre long and no more than 1 millimetre in diameter. And I'll usually do that twice to reduce the risk that we'll have to come back and do it again if the pathologist tells us we haven't got enough material to make a diagnosis. Once the biopsy's been done, I put a band-aid on the site where the needle has gone into the skin, and the patient will turn over onto their back and have 4 hours of bed rest. And that 4 hours of bed rest is important because any bleeding that is occurring will stop by itself as long as we don't interfere with it, knock any blood clot that's formed off of the kidney. After 4 hours, the patient gets up, and as long as they've passed urine and as long as there's no blood in the urine, they can go home. And it's very important that they remember that for a week there's to be no contact sports or vigorous exercise, straining or heavy lifting, because I don't want the clot that has formed where we've done the biopsy to be dislodged and result in any secondary bleeding later on. And then the biopsy results will be back, usually a provisional report within a few days. The immunofluorescence or immunohistochemistry, which is an important aspect of the pathology, takes a little bit longer, and if we need electron microscopy, that may take a week or 2 to come through. But usually I arrange to meet with my patients 2 weeks after the biopsy to go through the results and plan our next stage of treatment.